Hey guys, so today I'm going to show you how to use an app called the Clinical app because it's always conveniently there in your pocket because all of us have our cell phones with us at all times, and you can always just whip it out to make a reference to a patient if in case you don't have a computer near you. This is a lot more credible than Dr. Google, which most of us consult anyway, but this just makes you look a little bit more fancy because it has most up-to-date information using the best references, and it summarizes it to you in a nice little setting. So here you can look up different labs and values, assessments, guidelines, tools, nursing skills, diagnostics, some teaching, and some good old drug therapy. So we'll go under lab values and panels. And there's a different options where you can choose from. The commonly used for cardiology, metabolic electrolytes, endocrine, gastrointestinal, hematology, immunology, nephrology, every ology there is. So we will go under cardiology, and here we can choose from different lab values. What I'm going to choose is troponin. So here it breaks it down to clinical significance, reference range for two different kinds. So the clinical significance of a troponin is it's the most exclusive marker for diagnosis of a heart attack. And then here it goes into more detail. And then there you click next. It gives you the normal range, which is less than 0.035. And the onset is 4 to 6 hours. The peak is 10 to 24 hours. And the lab value returns to normal within 4 days. And this is a different lab value for troponin too. And then we can go under hematology, for example, and this is the APTT when people are on heparin. Gives you the clinical significance. It says the critical APTT is more than 70 seconds, which is determined by blood work. And then the reference range, a good range is 25 to 35 seconds. So there, if you go through all of those, it gives you the correct lab values and what they mean. Then we can go to assessments, which you can choose by body system, which we're going to do, and we're going to do a focused cardiac assessment. So here it tells you the purpose of the cardiac assessment is to evaluate the adequacy of a person's cardiac output and the general functioning of the heart, and to identify any abnormalities that appropriate treatment can be provided. It gives you more of a purpose, gives you the description of how to approach a patient. You introduce yourself, you explain the assessment, you put on gloves and you clean your stethoscope, and then you begin your assessment, you observe the patient. Then it gives you symptoms that you should look for of an acute coronary syndrome when you're looking at your patient. Then you listen to the carotid assessment, which then pops up this picture of the patient's neck. And then here there's a picture of a body cavity with, sorry, my computer froze, of a body cavity, and points out the different areas where the person should be listening when they're doing an adequate assessment. A is where you listen for the aortic valve, B is the pulmonic valve, C is the Erb's point, D is the tricuspid valve, and E is the mitral valve, and you want to make sure that you can hear the blood flowing through. And then here's just a picture of the heart so that whoever is assessing kind of knows where's the right atrium, the right ventricle, the mitral valve, the left atrium, and the left ventricle. Then and it goes further into more detail. Then here it goes over the S sounds to make sure that you are hearing them appropriately, and different terminology of a cardiac assessment. And that's just the references. Then we can go to guidelines, where your PPE, where you want to make sure you're using proper precautions. For example, we'll go to standard precautions. Standard precautions basically mean you apply to everyone in the same setting. You wear gloves, you wear a gown or a mask, you perform hand hygiene because not many people remember to. And it just goes over all the basics. And this is a good reference for people that are not familiar with it to go to and read up on. It tells you when to wear gloves when you're touching the patient, any body fluids or open skin, or when you come in contact with patient's environment or belongings. And let's see, droplet precautions, airborne precautions, and how to discontinuation of transmission-based precautions. Vaccines, it goes over all the different vaccines by age, birth to 18 years. It gives you a little chart of all the vaccines that every child should have. Then it also gives you immunizations for adults, also a chart with all the ages. Sorry, my hand hurts. And then we can go to tools. You can have algorithms, different ones that everyone in the healthcare can use. And then how many resources you need. And then there's one for vital signs. You do adult vital signs. And what is normal? The normal blood pressure is 90/60 to 120/80. You want to report any systolic pressure at less than 100 or greater than 170. Normal respiratory rate is 12 to 18. Normal pulse ox is 92 to 100. Normal pulse is 60 to 100. And it just goes over what the normal is so that if someone has a little bit of a concern, they can always look back and confirm. And in here it breaks down, this is the pediatric blood pressure tool, and it goes over vital signs breaking down to ages 0 to 5 months, 6 to 12, 1 to 3 years, 2 to 5 years, 6 to 10 years, 11 to 14 years, and 15 to 20. This is good for residents and nurses who are just starting out or skilled nurses that just need to brush up on their skills. Then we have here nursing skills, where you can go look at any kind of a procedure, like a good old chest drainage system, which is what I presented in class before. Here it goes over the purpose of the chest tube and the chest drainage system, what it's good for, where it's inserted. It gives you this nice little picture. We can go to next. It goes for assessment before chest tube placement. We want to assess the patient, their vital signs, review the orders, because you never want to do anything where you don't have an order. And then there's an assessment after you place the chest tube. You want to notify the provider if the patient develops cyanosis or low pulse ox. And it goes over every little detail, again for reference. And also there's a button for patient teaching. There's a chest tube size guide broken down by ages, because not everybody has the same body size at different ages. And the procedure of how to do it, and then the steps of doing it. And this is a chart too that kind of highlights of how to look at the chest drainage system. And then that one is done. And then there's plenty more. There was gastric and nasogastric tube feeding, NG tube insertion, ostomy bag appliance, emptying and changing, tracheostomies, urinary catheter, insertion and care, central lines, and every skill that anyone would ever need. Under the diagnostics, it basically is the different tests that patients can have to diagnose some sort of a medical problem. Here we can go to paracentesis. Here it describes the purpose, the synonym that may be used for the procedure. And then it goes the description of what the purpose of the paracentesis is, and the results, when the procedure is done, what the doctor would say the findings could be. Of course, they vary with different patients. And then there's nursing considerations, what every nurse that's taking care of or helping in a procedure should look out for. There's patient teaching and post-test consideration. That's the diagnostics tab. And then there's also a tab for teaching, what to teach patients about assistive devices, transferring and lifting, how to use proper body mechanics, because that's very important, because then the insurance company will not pay for your medical leave. And then drug therapy, this one I just narrowed down to diabetes, but there's many different options to choose from: cardiovascular, gastrointestinal, any sort of medicine that the patient might be on for reference purposes that any healthcare professional could need. The end.